Hi, good evening. My name is Erica Tapia. Thank you again for consenting for the heart and neck vessel peripheral assessment. First, we're going to go ahead and observe and palpate the carotid pulse. And with that, we go along and we go ahead and start palpating. There, I can feel the carotid pulse. We go side by side. Again, that's the carotid pulse. We can observe the jugular vein is usually the main vein in here. We estimate the jugular venous pressure right here. Please move your head to that side. Here we can see it. Then we're going to go ahead and describe for the location of the apical impulse. So to assess the apical pulse, it will be located on his left side. Your apical pulse is located above the apex of your heart. Your apex is the tip of your left ventricle that points downward in the left side of your chest. So it's going to be right here. Then we go ahead and we start auscultating for the anatomic areas where you can listen all the ideally normal sounds S1 and S2. So we go ahead and we start auscultating for the S1, which is a normal single sound, because the mitral and the tricuspid valve closures occurs almost simultaneously. Clinically, S1 corresponds to the pulse, and the second heart sound, which is the S2, represents the closure of the semilunar or the aortic and pulmonary valves. We will listen to any systole and diastole for any extra heart sounds, any murmurs, and if there's any murmurs, then we will advise our MD for any abnormal sounds and then refer to cardiologist or monitor and treat from there. So we go ahead and we can see the patient is in a sitting position, seated upright position. We will also inspect for the arms, and with that we can see the peripheral vascular system. We inspect the arms, we check for color, size, any abnormalities, any lesions, any masses. There's none at this moment. He's on his regular warm tone and skin color. There's no lesions, no masses, or no irregular colors at the moment. We will go ahead and inspect for the radial pulse, which is going to be located right on by the thumb. So we follow the thumb, and this is where the radial pulse is going to be. There it is. Then we go all the way up, and we go towards the brachial pulse, which is going to be located right in the middle of the arm. And again, we go ahead and palpate for it. And there it is. We will inspect the legs for its normal color, the size, any lesions. We don't see any lesions, no masses, no irregular tones. So no, the traffic changes. So traffic changes usually refer to abnormalities such as pitting of the nails, increase or decrease hair growth in the limb, and changes in the skin tone. For the inguinal area, this is the inguinal area where we can check the inguinal nodes. And for the femoral pulse, we're gonna go ahead and check on the legs, which you will also have the posterior tibial dorsalis pedis and the popliteal right in the back of the knee. And that's what we have for now. Thank you so much for consenting for this assessment. Have a good day.